You're listening to Cancer Convos with Brady and Stacy.
Hello there. Welcome to another edition of Cancer Convos, sponsored by Chelsea Smith Cosmetics, the Bismarck Cancer Center, Give 5 to Cancer Foundation, and the Jolliffe Institute of Restorative Medicine and Aesthetics. I'm Bob Brady.
I'm Stacy Sturm.
We haven't recorded Cancer Convos since we both got cancer, which was a long time ago.
It does feel like it, doesn't it?
This was our
we did it 2 weeks ago. We had Jennifer Greenhut on.
I know, but this is like our foundation show, and we've added 2 more podcasts since. And this one's like, screw that cancer
this
stuff.
Is the one we actually get paid for.
Forget that. We have other things. By the way,
God.
If you want to hear more of us not talking about serious things like, cancer, we have 2 other podcasts. One's called 24 Minutes with Brady and Stacy, which is really laid back and fun. It's a 24-minute podcast. Like, we have a guest on. We've had North Dakota Senator John Hoeven on. We've had impressionist extraordinaire Ben Campbell on. We're looking to get the lead singer from Tag Team on very soon.
Kat Perkins was on.
Oh, Kat Perkins was on a couple weeks ago. And then the other one is the 6-pack throwback that we do, where Stacy and I pick 3 songs each. It's a 6-pack of music thrown back in time with a certain topic, and we just reminisce about
songs. We pick songs that apply to the topic of the day.
Yeah. So the topic today is cancer.
What's your top 3 songs?
Here's my top 3 cancer songs.
Oh.
And we found it on previous Cancer Convos podcast. So one of your top cancer songs is Tub Thumping's Chumbawamba. But yeah.
Okay, now that's the thing is, like, I think everybody that goes through chemo or radiation or anything that's going to take a while, they put together a playlist of things that inspire them,
songs,
uplifting songs and make them happy. There's not necessarily any rhyme or reason to it.
But I think there is for other people except for you.
Makes me happy. Yeah. And it's very much like, you know what? I get knocked down, not necessarily by alcohol, but chemo.
Which is what the song was about.
And I get up again.
Yeah.
So I get knocked down by cancer, but I get up again.
Yeah, I don't have a playlist for. I might go to radiation and lay there for 35 seconds. They shoot me full of.
I was gonna say radiation doesn't take very long though, does it?
No, they just shoot me full of something. They all leave. I'm just laying there getting radiated. I don't know. My
chemo used to take. Well, the first time it took 8 hours.
Wow.
Because they want to put it through you really slow to make sure that you're okay and you're not having any allergic reactions to it. And they want to try to stop that before it happens. And then the second time, it took about 5 or 6 hours. And then by the end, I was a champ. I had that thing down to about 3 to 4 hours. They were pumping that through me at massive speeds. And I was just taking it.
So what is chemo?
Yeah, so this would be good. We've never really talked about our treatments because I don't know much about radiation and you don't know much about chemo. So
I'm like Superman. That's who I am. So I'm like a Marvel cartoon character.
So now chemo, what they do is they take metals and put the heavy metals and put them in your body to kill off cancer cells. And unfortunately, good cells as well. So it's not uncommon when people are going through chemotherapy. It's happened to just about everybody that's gone through extensive chemotherapy. They have to hold you sometimes for a week or 2 because they've killed off too many good cells and now your body is trying to kill you. So they want to make sure you get a proper treatment, cell booster, fluids, whatever it takes to regenerate those cells so you don't die. And it's a very fine line, like my oncologist said. They tap dance a very fine line, and so they can tell, looking at your white blood cells, your platelets, whatever, every week, too vulnerable for chemo. If we give it to them, it's probably going to kill them this week. Yeah, so it's a good time. And I had 3 different ones, 2 of them all the time, and then one of them was thrown in as a little bonus.
Oh yeah,
once a month. which is nice. A little nice chemo bonus.
Bonus chemo, everybody. Good morning.
Once a month. So I had 3 different chemos, and what they do is they put a port for most people now in this area. I don't know. Other people get it as an IV, but the issue is if you're going to be getting chemo 20, 30, 40 times, you can blow your veins. Oh, wow. So what they do is they install a chemo port, which I'll see if I can show. It's hey, I'm going to give you a little show.
You can't. Oh, there it is. I see it. There it is. Go. I see like a
yeah. So it's a little.
I've seen that.
It's before. A little it's a little button there, and what they do is they take needles, and there's 3 little prongs on my button. I joke that it's my power on, power off button.
Oh yeah.
They take 3 needles, and they push it into this button. And then that's where the key and the button is attached to my artery.
Oh my God.
So what they do is they go in and they implant this under your skin, and then they take what is called a it's like a catheter tube. But it's got a special name, and my chemo brain is kicking in right now. But what it's attached to here, and they slice your neck open, and they attach it. They put it in your aorta, and then they finish you back up, and then
I'll stick with my radiation
for the first, I don't know, for the first week or so, your core sore where you have your plastic device, your power port, but you're also really sore. Like you have a wire now in your neck, and so when you turn your neck, it pulls because you're not used to having that there.
Yeah.
So it pulls really tight, and until it loosens up, your neck is really sore. You can't really move your neck very far. But then what they do is they come at you with these 3-prong needles, and they pop it into your chest, and it attaches there, and it sits there. And then they feed usually several different solutions through there, which is why it takes so long. The first solution is a saline to get you water, hydrate you.
And there, yeah.
The second is an anti-nausea medication.
Oh, yeah.
Like Zofran or something like that. The third one, I forget what it is, Benadryl. So you don't have I get a whole bag of Benadryl. So you think 2 pills knocks you out? Get a bag of Benadryl, will you? So then they give you a bag of Benadryl to make sure you don't have an allergic reaction. And then you get a bag of each of your chemos. And then at the end, they push it and they pop out the needle. And I don't know exactly how they do it, but it's like they pop it out, and then they bandage you up, and you're good to go until the next week. Yeah, so or the next couple weeks, or the next month, or whatever it is. I had it every week until they had to stop me because I'd killed off all my white cells.
Yeah, it doesn't, yeah.
So then I had to go in. They're like, we'd like to hold you, but what's happening is your cancer is, we need to make sure we get rid of this as soon as possible. This isn't one thing we can do, like chemo on you every month.
The worst.
So they give you a shot that is supposed to, it triggers your bones to make more marrow and more white blood cells. And so then I can get chemo the next week. But that, I feel like, was worse than chemo. Like that was, I can't even describe the pain you have in your bones from it jumping in to this high kicking things into motion,
making the bacon. Yeah.
So the pain it was so, there's just no way to describe it. Like it just is a pain that I've never experienced before. It's almost like having like a bone marrow transplant. Do you know what I mean? It feels like, if that's what it feels like, and it's very aggressive and it hurts for 2 to 3 days, and then it kind of goes away a little bit and you're okay. But the pain was bad, and it used to make me kind of nauseous too. But so that is if you're just diagnosed, this is what you have to look forward to.
Like fun.
That's the chemo process that you go through.
Isn't
And
there, you think, in 2023 a better approach than what seems to me? Because again, I have cancer. I've only had
yeah.
radiation and a radioactive iodine pill. The barbaric approach that they use with the chemo, you know what I mean? Like there's,
Yes, yes, but no. So it, how I described it, it seems like it's crazy to most
yes,
people. And when I went through it the first time, well, and here's what they don't tell you
no,
what's really going on. And you've been through this. So when they said you're going to get your port put in, I did not know what the hell that even meant. They just assumed, I suppose, I was going to Google it or that I knew somebody that had one. I had no idea they were going to operate on me. They were going to take me in there, operate on me. They don't put you to sleep either. Like you are awake while they're cutting open your chest, putting this device in under your skin, and then putting it in your neck.
yeah,
You're awake. And so I was kind of like, oh, what in the hell is going on here? And it's crazy. It was only about a 30-minute process. And then all of a sudden they're like, all right, you can go. And I was like, what the hell just happened to me? All of a sudden my chest is black and blue and my neck is black and blue and I'm bandaged up and they're like, have a good day. And I was kind of like, I'm really confused as to what the hell just happened. Did you just cut it to my
yeah. Did you wait a second? This isn't from a movie.
this isn't quite right. I feel like something's not right. I feel like so when you're first going through it, it's really confusing, but then I have to say, once you get it, it's like once you've gone through it, it's not barbaric and
Yeah, yeah, but
it's not that it's really not that bad. It really
they don't
isn't.
explain it. Like they don't explain
They
anything.
need to
Hey,
explain it. They really
yeah,
need to have somebody, even if or sit with a cancer patient or somebody that's gone through it or something.
it's just
I kind of knew what to expect, but I really didn't know what to expect.
yeah. I don't. They I think they feel that we just are more intelligent than maybe we
Well,
give off.
they're looking at it from an insider perspective of they do this every day
Yeah, I
and
don't.
they don't see it from the outsider perspective of what in the hell's going on.
Yeah.
And you've been through this, when they gown up, when they put on a hazmat suit
Oh,
and come into the room,
yes.
you're like, what in the Sam Hale is going on
Where am
here?
I?
Like,
Yeah, what
and
happened?
yeah, so it's kind of alarming, especially for being your first time, and and when they explain it to you, then you get it, but it's like, it's really,
Yeah, it's you're right. I think they just go through it through the motions so much. Like it's just like, okay,
it's so
this is
secondhand to them, they don't
patient
realize.
B.
Yeah, and they just don't realize because they do it so often. Like if we were to explain the process of what our morning show was like when we would do our morning show, it would seem crazy to a lot of people. They're like, "What?
Let's not
You
get
like for
crazy.
radio or TV?"
There was nothing
But
to it. It was come on. We showed up and talked. We got
no, we
paid.
did prep and we
I
booked
know we did.
guests and we had to do all this stuff, and you have to put these in, you have to do
It
technical
is. We're
stuff,
like
and
I'm like a magician over here. You're right.
yeah, but it's so secondhand to us because we're trained in it and that's what we did, that
Yeah.
it doesn't seem like an odd thing because
I
we're
just think
so close to the subject.
so. When I go to the dentist, like
Yeah.
I'll sit at the in the chair, and I'll sit in the chair, and the hygienist comes in and she goes, "Hello, Bob." Blah 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 blah, and then she'll go away, and then some other person comes in from the front desk and sits next to me and goes, "Oh, so they're gonna do this, 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 and this. You
Yeah.
want to have this done today, and this is how they're gonna do it." Like that's to me, like that is a little over the top because now this person here is like my billing consultant. Like, pick what you want to have
Yeah.
done today. No, just
Right.
tell me what's going on. So there's got to be a happy medium, and there probably never will be. It's just the way it is.
No.
But it just sucks because, like, you've gotten the cancer diagnosis, and you don't know what to do. And of course, they hop on WebMD or Google. What is this? What am I going to do next? Or maybe they think somebody that knows somebody that knows somebody that has cancer, and
Right.
you'll reach out. But that's not everybody.
And it's hard, and it varies from place to place, which I think is why it's probably so hard for us to explain it to people, because what I went through is probably not what chemo patients Arizona go through. I mean, the general part is, but like I was lucky, we had like these little private kind of rooms that you could sit in, and you had lounge chairs, and you had they gave you snacks, and you could watch TV. I just listened to music. I had very
Chumbawamba.
little. Yeah, and so my friend Dolly, we all know
Yeah.
Dolly
Dolly, yeah.
that worked radio with us. So when she went through it, she says there's no way you're going to be able to sleep because all the machines around you are going to be going off. And they do. They beep when you're supposed to change the bag. When the bag gets low, or if there's an air bubble or something, machines will beep to let you know that let the nurses know it's time to change the bag. And she goes, you're going to hear all of the noise. You're not going to be able to sleep. Well, I was super lucky where I was getting my chemo at. We had private rooms.
Oh,
I conked out, man. Put in my earbuds. I was out. I didn't have to mess with anybody. Occasionally, and this is so hard, occasionally I would see somebody like walk by and they're like crying or upset, or they're having an adverse reaction or not feeling well. I might hear somebody in the room next to me like crying, having a hard time. But for the most part, I really didn't hear much. But a lot of super cramped places where people go to chemo, where it's super cramped, it's super busy, it's super noisy. They're constantly like going from patient to patient to patient to patient. Like it's super. And I actually had, it's like my own little private room where I had my little special blankie, and I had my snacks like a little 6-year-old child. I had my snacks, and I just really was able to kind of enjoy the experience. I know that sounds crazy, but Jennifer Green had talked about that when we had her on there. I used it as a time to meditate and really appreciate the fact I was getting chemo and this was killing cancer, and I was being able to take this little break. And yeah, so it was a really pleasant experience for me. I don't know how to describe it, but it wasn't a terrible experience. It really wasn't. It sounds barbaric, but it didn't feel barbaric. It felt very nice, and it was a really nice time to sit and reflect and just enjoy the time off and meditate and pray and think about things or take a little nap. It was so chemo, and chemo doesn't necessarily make you sick like it used to.
Yeah.
That was barbaric, man. I think what they used to do in the 60s and 70s, oh God, people would get chemo burns and they would get sick all the time. And there was none of that. But and maybe it was just me, maybe it was my attitude, or I was just lucky, or my body chemistry. I really didn't get sick from my chemo.
I've heard that too, that people have, like, they get sick from it.
Yeah, when
like,
my
nausea
meds wore off about 4 or 5 days later,
Yeah.
then I might start to get a little bit sick, but then they give you Zofran and they give you other things to take at home, and there's like lollipops and there's things that you can take. So I was lucky. I really didn't have those nauseous, throwing up kind of side effects that most people did. Yeah. So
For those that do,
I have to say chemo really didn't affect my life much at all, except I had to take every Wednesday off to go get pumped full of heavy metals.
yeah, Quiet Riot, Iron Maiden.
Yeah. But otherwise, was I tired? Oh, hells yeah.
Well,
I'm still tired. Like
yeah.
I'm still tired now. But for the most part, I didn't have to check out of life like a lot of people do.
It just takes a lot out of you. Like
I just charged through it. Just did it. So what is radiation like? What is it like for you when you're going through your treatments?
It's a walk in the park. Like, you walk in there and you it depends what your oncologist says. Like, here's what we're going to try for you, So mine said, we're not going to do chemo because we're going to try to targeted radiation. Okay. So when I first had it in 2014, I took a radioactive iodine pill. When I was all done, I had 2 incisions. One to get the thyroid out, and then the next one to get like 38 lymph nodes out of my neck.
Yeah.
And then they took the thyroid. Like, everything was gone. So they took my little friend I had there, whatever it was. Looked like a goiter, but it was just a big mass.
Yeah.
Took that out. Did the radioactive iodine pill. That's the one where they walk with the hazmat suit and hand it to you in a, like a kiln of some sort. No, here, take this. And drink some water, then get the hell out of here. Like, okay. So, because you're radioactive, and then you're in your room for 3 days. You can't be by family. You can't be by toddlers. You just quarantined for 3 days. those radioactive iodine pill. I've done that twice.
Yeah.
Once was, I think, last year. And then twice in the last 2 years, I've had targeted radiation. So you go in and they mark you up where they want to target it where the tumor is. I have 2 tumors. So the first tumor they try to do, this is my thyroid cancer moved to my lungs. So the first one they try to do is on the right side. So they have like an X there and they mark you all up and they have it all set up for the levels so that the radiation machine, I guess it's like a big X-ray machine, can just zoom in on where that spot is. You see a little green dot go there, and then it just like it goes, and it's just, I would say, 30 seconds of whatever's coming out of there. I have no idea. Like I don't see it. Radiation. People come in, they go, okay, we'll be back in a minute, and then they go out. They play some, Joe Walsh on the radio, and you're sitting there,
a little yacht rock going on right there.
Whatever you're sitting there listening to, and like the one time they go, hey, what do you listen to? I said, well, I don't listen to this country shit. I know that. That's got to be gone. So they changed it to some, I don't know, 70s, whatever. Anyway, so they walk out. They go, okay, here it comes. And then they hit the button. You hear it go click, click. And then that, wah, and then they come back in. Okay, we're done. Need some help up, lift up, do it. So one time I did that for, I think the first time I did it for 10 straight days, Monday through Friday. And then the next time, this last time I did it was 21. So it was 21 doses. And, they say it's like 0.3 mercury or whatever the hell it is. I don't know what it's broken down into, but they have so many that they're going to get into you within that time.
Yeah.
And I just had my tests last month. They're still there. They're smaller, but that's where my question is like, what's next? Do I do more radiation? That's where I think I have my appointment coming up the end of this month, whatever it is. And we'll see what happens. And it's just,
well, I highly suggest chemo if you want to.
That's the thing. Like
get
you
some
back
chemo.
Just,
add that to your.
You're at the mercy of the tests, right? Like you don't.
Yeah.
Like I feel it. Like you said, you're tired. Like I'm tired all the time. Like if I go to work or if I do coaching with the kids, and the next day I'm like, oh my god, I'm just beat, just because it's, I don't know if it's cancer. I don't know if I'm a big fat ass. I don't know what it is, but I'm just tired, so I want to sleep. And for a lot of people, like you said, to get that chemo, this knocks it right out because you're so tired of it. You're working, so your body's working overtime to get you healthy.
Yeah.
So
I did have a lot of friends give me advice too, like when you're going through treatment, like set yourself up for as much success as you can by like eating a lot of protein so your body can heal quicker. Try to cut out the sugar and the bad stuff so your body doesn't have to work so hard. And so I tried to just take care of myself and hope that made it easier and better.
Like we had the Fandriches on our first show or our second show. That was like, they told him that, like, take care of yourself, eat this way, take these medicines, blah, blah, blah.
Yep.
I've never had that. No one's ever told me that. Like they say, eat healthy. Well, what is healthy? Like cut out pop, cut out sweets. Give me a
right. Yeah. That's kind of subjective. Yeah.
Give me something. What do you want me to eat? I'll eat it. You need to eat Brussels sprouts. Ooh, stuff like that.
What I struggle with now is the after effects of chemo. And I'm really trying to lose about 20 to 30 pounds.
Okay.
And the two things you need to do are eat better, like eat good, eat not as much, and exercise. Like that is what you should do to lose weight. Everybody knows that. I really can't do either of those. Like I'm having a hard time exercising because although I feel a little bit better now that I started doing occupational therapy, I don't have as much pain as I have had in the past. So my pain's a little bit better. So I might start being able to exercise here soon. It's just been a time constraint now, and October is my busiest month at work. But and the past couple days, I've really tried to eat a diet of primarily fruits, vegetables, protein shakes, really super lean meats, like you should if you're trying to lose weight. My body wants more than that, and not just like fat hungry Stacy. My chemo pill is tearing through my body.
Wow.
Like I can't even describe it. The pain in my stomach now when I take my chemo pill, because it's not full of carbs, heavy foods, um, it hurts. I was doubled over last night for about an hour, and I was just on the toilet, both ends. It was coming out because it's too hard on my body just having a diet of my blueberries and strawberries and a little chicken at night. It needs more than that to not wreck my system.
Yeah.
But I don't want to do that because I don't want to eat big, heavy, fatty, heavy things before bed. I'm trying to lose weight. I don't want to eat that at 10 o'clock, 11 o'clock at night when I need to take my pill. I just want to eat a handful of peanuts and some blueberries. Nope. They're like, nope, that's not the way it's going to
go. I just want to have some blueberries and peanuts.
I just want to eat some fruits and some nuts.
No.
And my chemo pill has different ideas. So,
and you're on that chemo pill for the rest of your life.
Yeah, probably at least for like the next 10 years, I'll be on that pill.
Well, then at that 10 years, then you can start doing fruits and blueberries and peanuts. In the meantime, Asian buffet. And,
I'll be 500 pounds by then, though.
You will not. You don't have that big a frame.
Oh,
you'll be a good 250. Yeah, it sucks.
Yeah.
Same thing here. Like I have those two tumors. Like you can hear my voice. Like I just every once in a while, I get all phlegmed up and I just can't.
Yeah.
Start hacking. Like we moved last month. I'm like, I got to sit down for 5 minutes, and Heather's like, "You're no help at all," because I'm not. Like I'm not what I was 3 years ago.
Yeah.
You know? Well, here's a quick thing. How many people are diagnosed with cancer each year? So far in 2023, roughly 2 million people will be diagnosed with cancer in the United States. An estimated 297,000 women and 2,000 men will be diagnosed with breast cancer, which makes it the most common cancer diagnosis. Prostate cancer, leading cancer diagnosis among men, and the second most common diagnosis overall, with 288,300 expected cases. Lung and bronchus cancer is the third most common cancer diagnosis, with an estimated 238,000 new cases.
That surprises me.
Smoking, huh?
Yeah, I would. But God, do a lot of people smoke anymore? It's got to be old people getting diagnosed with. I don't know. That's just crazy to me. But yeah, I wouldn't think that would be such a high number.
That's from the National Cancer Institute website, just so you have some reference there. But it is staggering how, like, I'm looking at this now, like compared to the 12 most common cancers are breast, prostate, lung, colon, melanoma of the skin, bladder, non-Hodgkin lymphoma, kidney and renal pelvis, uterus, leukemia, pancreas, and thyroid. And thyroid cancer in 2023 is more common in women than it is in men.
I think it's a hormone thing. Yeah, I think it's a lot of it. A lot of the cancers are fueled by a lot of hormone issues, I feel like. So
how do men get breast cancer?
Well, they have fatty breast tissue just like women do.
And that's what happens.
That's what happens. I mean, as long as you have breast tissue, you can get breast cancer. So yeah, men, women, whatever. And I think it's a misconception too, that you have to have a lot, like if you have a lot of fatty breast tissue, you're like more
big
prone
boobs?
to get cancer. Yeah, no, that's not true at all. It's just,
I like big boobs and I cannot lie.
As long as you have breast tissue, you have a chance of getting breast cancer.
And women have prostates, right?
No.
Oh, I didn't know that.
We do not have prostate glands.
I learned something today on this episode of Cancer Convos. I don't know. What am I, a biologist? So that's why the men outweigh the women, whatever, to zero in the prostate cancer department.
That would be why, yeah.
So that would mean that down the line here, that men don't have uteruses, while women do. Correct.
So there will be no men getting ovarian cancer.
That's the flip. Prostate, uterus. Got it.
Yeah.
I feel like I'm in health class all over again. I didn't listen to health class.
God.
Hey, whatever. That's why we're here talking about it, right?
That's what we do.
Yeah. So get yourself checked out. I know October is Breast Cancer Awareness Month.
It is.
So get out there and get it checked out. Get yourself a mammogram. I've heard from Heather they're not fun, so go for it. Anybody squeezing my nipples and my boobs, I'm not doing it. I don't want anything to do with it, especially metal. Like I'm not any part of that. I don't want a nurple. purple nurple. I don't want any of that.
Oh God. Well, I think this has been a very productive cancer conversations. Cancer combos.
Yeah,
I
learned
do.
about
I really feel like we do.
uteruses. Like, what do you do?
I've learned what radiation process is like. You've learned what chemo process is like.
I mean, what are we
not,
doing, right? Yeah.
Not too shabby.
I would take mine every day over the chemo stuff, just because. Like, I don't know. That's why I asked. There's got to be. You think to be a better way than throwing metal at whatever to kill it? I don't know. Like, I guess that's again. I'm not a doctor, so I don't know these things. So
yeah.
Anyway, Cancer Convo is sponsored by Chelsea Smith Cosmetics, the Bismarck Cancer Center, the Give 5 to Cancer Foundation, and the Jolliffe Institute of Restorative Medicine and Aesthetics. We thank you for joining us. Hopefully you can learn something from this. Tune in again next time. We'll hopefully have some superstar guests and go from there. Thank you.